Neurology quiz number 38. What is cortical basal ganglionic degeneration? Cortical basal ganglionic degeneration is a neurodegenerative disease that usually occurs in the sixth decade and affects men and women equally. It is classified as a tauopathy. Pathological changes occur in the cerebral cortex and substantia nigra and consists of tau-positive neuronal and glial lesions. These inclusions consist of hyperphosphorylated tau. Grossly, the brain is atrophic, and both atrophy and the microscopic changes may be asymmetric. Clinical features are indicative of focal rather than diffuse pathology. These consist of asymmetric Parkinsonian features with rigidity, bradykinesia, and postural instability. Resting tremor is not prominent. Other features include asymmetric limb dystonia, action tremor, and myoclonus. Asymmetric corticospinal tract involvement with focal weakness, spasticity, and hyperreflexia can occur. Focal limb apraxia is common and disabling because it interferes with the simplest self-care tasks such as buttoning a shirt or combing hair. Focal impairment of cortical sensations with astereognosis, graphesthesia, and neglect may occur. A striking feature is the alien limb phenomenon, in which one of the patient's limbs behaves in a semi-purposeful or autonomous way. For example, the patient's limb may rise even when the patient did not intend that movement. Cognitive deficits include deficits in language, especially naming, and visuospatial defects. Memory is involved late, in contrast to Alzheimer's disease. Brain imaging may show asymmetric and focal cortical atrophy, especially in the frontal and parietal lobes, and PET scan can show asymmetric hypometabolism in the basal ganglia and cortex. Cortical basal ganglionic degeneration is one of the Parkinsonian plus syndromes. The term corticobasal syndrome is sometimes used for cases which are not autopsy proven. Parkinsonian features do not respond to dopaminergic agents. Clonazepam may be helpful for myoclonus, and botulinum toxin can be administered for focal dystonia. Death usually occurs 5 to 8 years after the diagnosis. Other tauopathies include progressive supranuclear palsy, frontotemporal dementia, and chronic traumatic encephalopathy.